Hello again, I'm Dr. Craig Childress, clinical psychologist in Pasadena, California. I work with attention deficit hyperactivity disorder, angry oppositional defiant children, parent-child relationship problems, marital problems, things like that. And in this set of video segments, I'm discussing a particular parent-child relationship problem that I refer to as parental alienation dynamic. And by that, I'm referring to a specific structural family systems process involving a particular set of DSM-4 diagnoses. In this particular video segment, I'm going to be discussing the different approaches to child psychotherapy. Now, as I mentioned in the previous segment, we first start training therapists with adults, and then if they seek additional training, they can seek additional training in child psychotherapy. And there's two primary approaches currently in child psychotherapy. The first is play therapy, and that emerged back in the 1950s from the work of Anna Freud, the daughter of Sigmund Freud, as she adapted adult psychoanalysis to use with children. And the adult psychoanalysis was called the talking cure. The adult patient would free associate, and then the analyst would analyze the associations for various supposed internal conflicts. Well, as Anna Freud tried to adapt that to children, there's a problem because children aren't very verbal. They're not, talking cure is not going to work for them. But what children do is play. And what Anna Freud proposed is that we could allow children to play in the therapy and then analyze their play symbolically for the internal conflicts that were causing the symptom. And so that gave birth to the idea of play therapy. Then the group of humanistic existential psychologists took off on this idea and proposed that actually what play could do is allow the child sort of to express their inner experience, and if they were allowed to play in sort of a non-directive, free and accepting kind of environment, mimicking Carl Rogers' conditions of empathy, unconditional positive regard, and genuineness, if the child was allowed to sort of play in a non-directed way, that they would sort of naturally work through their issues and develop a sort of a self-actualizing growth process. And this particular type of play therapy model was articulated by Axline. And it's right now in child psychotherapy and play therapy, what my experience is most therapists that work from a play therapy model kind of use a combination of the two. Primarily humanistic existential, let the child play and express themselves in a non-directed way, but they also interpret the play for potential issues involved. You'll recognize a play therapist by all the toys in their office. Oftentimes they'll have a dollhouse with all these doll figures so the child can play out relationships within the family. And just personally, I think play therapists are wonderful people. I'm not sure I support the underlying models that they work from in terms of the child self-actualizing. I don't think that's supported by some of the neurological research on brain development, and I don't think neither is the analyst proposal that you can interpret it for inner conflicts and that's the source of issues. Again, I think some of the neurodevelopmental research would tend to challenge that idea. But the therapists themselves are wonderful people, and a lot of growth can occur through the relationship processes that take place during that process. But primarily, my view is it takes place through non-specific factors. It's not a result of the underlying theoretical model. The second primary approach to behavior therapy, and actually the dominant paradigm right now, my estimate would be about 80 to 90% of the child therapy out there, is from the behavioral school. And behaviorism is drawn from research in the 1940s and 50s, modifying the behavior of lab animals, particularly lab rats, in this little contraption called a Skinner box. And I'm maybe one of the few psychologists who was actually trained in behavior therapy by first training a rat in a Skinner box. And then they would layer on the additional levels of behavior therapy above that. The idea of behavior therapy is that our behavior is based on our learning histories. And so by altering our learning history, we can alter our behavior. And what they came up with when training rats in the laboratory is that reinforcing a behavior will increase that behavior. So rewarding it increases a behavior. Punishing a behavior decreases a behavior. And removing the reinforcement from a behavior will also decrease that behavior. That's called extinction. In addition, we studied all these various associated features of learning, such as cues and stimulus control, shaping a behavior, fading out the reinforcement, different reinforcement schedules, things like that. And back in the 1940s and 50s, because there was a reaction against psychoanalysis as being unscientific, there's no way to prove it or disprove it, the people who were scientifically based back then turned to the science of the day, which was this learning theory, and said, let's apply it to people, and in particular to children. And so back in the 60s and 70s, behavior therapy began to be applied to children. You'll recognize a behavior therapist because they will talk about consequences, consistency, rewarding good behavior, consequences for misbehavior, and that sort of thing. You'll have star charts, point systems, things along those lines. Now, behavior therapy is actually going to create a number of problems for the parental alienation dynamic. It will actually feed the process. Play therapy is actually going to be irrelevant, and the play therapist will actually probably begin to collude with the alienating parent in supporting the child, because it's non-directive, and the child is saying, I hate this one parent. That play therapist is not going to challenge the child. It's non-directive therapy. And so they will believe the child and provide the child with this nurturing, warm, wonderful environment, and they'll do that for years and years and years, and nothing's going to get better. The behavior therapist is going to recommend that the target parent apply reinforcement for positive behavior, so praise their good behavior, give them points and stars, for their good behavior, and then provide them with negative consequences for their negative behavior. Take away their toys, put them on timeout, do things like that. The problem with the behaviorist approach, when applied to the parental alienation dynamic, is that first off, the child doesn't present that much good behavior, so the targeted parent doesn't have much opportunity to reward good behavior. The second problem is when the targeted parent applies the punishment, that actually feeds the alienation narrative of the allied parent, the alienating parent, and the child, who want to present the targeted parent as being a mean and hostile person. So when the targeted parent takes away a toy or does something, the child then uses that as justification for their anger, and the alienating parent also uses that as justification for the child's anger and why the child doesn't like the targeted parent. And so it actually is a setup for the targeted parent. It sets the targeted parent up to be the bad guy and makes the whole situation worse and further impacts the relationship processes involved. So neither play therapy nor behavior therapy are appropriate treatment conceptualizations for addressing the parental alienation dynamic. In the next video segment, I'm going to talk about family systems therapy, which is the appropriate model for conceptualizing and treating the alienation dynamic.